Cardio-oncology is a new evolving field in oncology and is not myeloma specific. This is something that is applicable to all subsets of oncology, both solid tumors and hematology oncology. I think it's simply a reflection of the fantastic success we are seeing when we are treating patients. As patients live longer, much more focus will be on quality of life and having the rest of the body in good shape after therapy. And a lot of the older therapies, they were very toxic, and transplant is one of them, but there are a lot of other drugs that have been very toxic. Specifically in the more modern era, there have been some reports on proteasome inhibitors maybe causing cardiovascular outcomes. We actually had a presentation here. It was a small follow-up study on a phase 2 trial that we had published last year in Blood Journal. And we screened for baseline samples with a panel of almost 100 cardiovascular markers that we know in the population that if you have those elevated, you're more likely to develop cardiovascular disease. So we looked in patients with myeloma that were treated with a proteasome inhibitor, Kyprolis, and then we had follow-up time on these patients. So we knew who had or who had not had cardiovascular events later. And when we looked in these baseline samples, we see that those few people who had cardiovascular outcomes, they actually had some of these markers being altered already at baseline even before exposure to drug, suggesting that maybe there are some people who are more susceptible and they need to be monitored a little bit more carefully, and maybe some patients should be treated with other drugs. But I would like to emphasize that these drugs are extremely effective, and it's a small proportion of patients who do have these problems. I think everything should be viewed in the light of risk and benefit, and the benefits are very, very good for these drugs.